All right, Adam, thank you very much. Well, today is National Fentanyl Awareness and Prevention Day, with the Drug Enforcement Administration calling fentanyl the single deadliest drug threat that our nation has ever encountered.
We certainly have heard our share of stories here in the Midlands. Now agencies nationwide trying to educate the public and warn you and them about the growing abundance of that drug. There's still a lot to learn and a lot of work to do on the streets to make sure that they stay out of the hands of the public. But today, Judy, we're looking at it from a different lens, a different perspective.
We are indeed. Joining us live in our studio to tell us more about this issue and the impact right here in our community, Richland County Coroner Nada Rutherford. Nada, thank you so much for being with us.
Thank you so much for having me.
You know, those who follow you on social media have heard you talk about this issue before. When you look at it, and you know, I always look through the lens of a mom, of course, at first, and I know that you do too, and you look at the impact that it is having on children. You look at the dangers of taking something and not realizing what it really is. How prevalent is the fentanyl problem in our community?
So let's think about it this way. In 2022, there were 130 total overdose deaths here in Richland County. 77 of those were fentanyl related.
Wow.
People don't realize that this drug is so powerful. It's 200 times more powerful than morphine. It is normally prescribed in micrograms because that's how powerful it is. So when you get it off the street and it's illicitly manufactured, it is at rates that are so ridiculously high, and it is causing people to die.
Yeah, and when you go to those scenes and you know you're seeing that this is the cause of death, how frustrating and I guess emotional is that for you to know that this is something that is just wiping people away and there seems not to be a hold on it right now?
I think the most shocking part is that there's no age group that it's affecting more, it seems. We have people as old as 87 years old dying from fentanyl overdoses and as young as 17 dying here in Richland County. And it's very sad because it seems to transcend race, age, socioeconomic background. It is prevalent. I encourage people, don't take medication that doesn't belong to you. You could ask someone for a Motrin and they could have it in their pill bottle and you accidentally take it. We've had cases of accidental overdoses related to drug diversion because someone took someone else's medication.
Wow.
It is a problem here, and it is so readily available. It looks like candy if you find the colorful kind. Children have taken it, and we haven't had any child deaths related to fentanyl, but across the country we've certainly seen cases like that.
Yeah, it's very alarming. When you talk about this drug, Nada, what are some of the myths that we need to dispel? Because I know there's such an emphasis on being able to provide a path to recovery.
Yes.
And we want to make sure that we share those resources. In fact, in just a moment, we'll have access where people can get free Narcan and the training about how to use that. But what are some of the myths that we need to dispel in order to really be able to deal with this?
We need to have the hard conversations, Judy. We need to talk about it with our family members who are at risk. I want people to think about the disease of addiction like you would think about diabetes or hypertension. It is a chronic illness, and the more we treat it like a chronic illness, the more we will decrease the stigma around drug use and addiction and start to come up with solutions. We need to talk with our at-risk family members and tell them fentanyl is in marijuana. It's in pill form. It can be smoked. It can be rubbed on the gums, absorbed through the skin. So we want to make them aware so that they can be safe. We don't want anyone to die. We're certainly not encouraging anyone to do drugs, but if they have the disease of addiction, they may fall prey to that, and so we want to keep them safe.
Speaking of contact and, you know, in making contact with your skin and absorbing in your skin, if someone is experiencing an overdose, how does someone else respond? I know if you don't have Narcan, if you touch them, are you going to be exposed as well? That seems to be a concern for some people.
It depends on how they administered the drug to themselves. So if it is in powder form and you're sweating, it could be absorbed through your skin. The best thing to do is to call 911. Don't try to be a hero. It is not a crime to be high. It is a crime to have possession of the drug, but you will not get in trouble for calling to ask for help. So call 911. That's what I encourage everyone to do.
We want to share information about where the free Narcan is available. You know, I mean, it's essentially kind of an inhaler type of thing, or
It's a nasal spray.
A nasal spray, exactly. Is there any specific training required in order to be able to administer it?
You just need to go through the very simple, very quick training that shows how to administer a nasal spray. If you've used, you know, any sort of nasal spray during allergy season, you can do it. If you can do like this with your hand and push up on that, then you can administer Narcan. And what we encourage the community to do is to have it on hand. If you're a church, a recreational center, if you know that your loved one is suffering from the disease of addiction, go to Loradac, ask them for the Narcan, because it's a no questions asked process, and it is available and readily available for our community to use.
That's so important. As the coroner, what ways are you helping the public educate themselves about fentanyl and drug overdose before it gets to the point where you have to deliver bad news to a family?
We are having the hard conversations. We're posting things on social media. Sometimes I'm criticized because I try to add a little humor to it, but it makes people watch the videos. And so I'm going to continue to do that. We're doing Ask a Doctor talks in our community. We're going to bring, in 2024, we'll have a doctor who specializes in addiction so that we can talk about it in more detail, so that when families go to the doctor, they will know what questions to ask and how to best help their family members.
Well, we're looking forward to covering that, and I just want you to, once again, especially with school back in session, and just knowing, you know, parents think they know everything, you know, about their kids, but they don't know everything that their kids are doing. Whatever guidance or advice you might have for parents or for students in terms of being careful about what they take from someone else and the dangers of this drug, and how parents need to approach this so that their kids can trust them enough, you know, to be able to come to them if they need help.
The number one safety tip that I have for families, for college students, don't take anyone else's medication. That's the number one tip. The second thing is, if you have a drink and you leave it, don't go back and drink that drink. If you're at a party, we know 5 Points is a very popular destination for our college kids. Stay away from a drink that you have not seen the entire time. Follow the buddy system. Have one of your friends watch a drink. But if you don't know them and you just met them in college, I wouldn't trust them.
Right. Really good advice there. And then we want to pull the information just once more about where you can access that free Narcan. As you heard the coroner say, it's not a crime to be high, so don't feel ashamed if you know someone experiencing this issue to call 911 and make sure that you have that Narcan on tap for you to use. You can go to Loradac, the Department of Mental Health right here on Bull Street, and the Bureau of EMS and Trauma also here in Columbia. Also Transitions, don't forget about that location at 2025 Main Street.
We've also talked to the Courage Center over in Lexington County. You can get it there as well. But I think the coroner touched on the most important point. We've got to have the courage to have these conversations and to really confront these issues head on, because that's the only way we have a real opportunity to provide some solutions and to save lives.
Yes,
ultimately, that's the goal, to save lives. Thank you for all that you do.
Thank you.
We appreciate
Thank you
you.
guys so much for having me and for talking about this very important topic.
Thank you. All right, we're going to take a quick break. Much more on the other side.